Good. All right. So it's just a recap of a sports map course I did a couple of weeks ago. It was presented by Michael G. Kumis and just looking at sort of common trends with hamstring and quad injuries, more so rec fems. So I've just put in what I found helpful. So yeah, we'll see what we get through, I guess. So he talks a lot about like your typical mechanisms versus your atypicals. So like we know that our common mechanisms for biceps, long heads are going to be like that sprinting mechanism at swing pace. And then semi-mem on kicking as well, so more that stretch mechanism. But if we find like an atypical finding, so any of those ones listed where it probably doesn't quite make sense with the mechanism, then we're just ringing a few alarm bells. And then things to be concerned or cautious about, which will influence the recovery process, are going to be those sort of muscular T-junction or tendony sort of injuries. So again, atypical findings, we need to hunt a little bit, so try to find out what's going on. So the dial test is something that can be useful for like recurrent biceps fem stuff. So if they have like any significant rotational knee laxity, then that's a finding that probably needs to be addressed in the rehab. Because we'll go on later with the anatomy, but biceps fem plays a pretty big role in reducing the amount of rotation that we get through that tibial fem joint. Any restrictions, so differences at R1, side to side, or R2. SIJ dysfunction as well, so again, with the anatomy later, but proximally the biceps fem fuses with the sacrotuberous ligament, so there's a theory there that it plays a role in some force closure. And then he talks a lot about the overcompliant tendon, so there's a lot of research on that with the Achilles and post-rehab there. But we can sort of apply the same theories to really any tendon injuries, in that if the tendon is overcompliant or not stiff enough, then that whole muscular tendons unit is going to have to work harder to do the same amount of work. Anatomy. All right, so just going to quickly run through just some of the like architecture related things. So semi-mem, it's the largest muscle, so it's going to have the increased amount of force, or the most amount of force output. It's got really, really short fascicles, so it's not able to really work over a long range of motion. It's got 25% of its entire length is tendon, so it's going to have a very high tendon to fascicle length ratio, which means that it's going to have quite a high tendon demand. Distally, its insertion is quite complex, so we can see that there's a few different arms, so like an anterior arm, inferior arm, and they all might have different functions or roles. So like the anterior arm runs perpendicular to the tibia, so that might tell us that it assists in reducing rotation, as well as posterior medial core instability, MCL, meniscus as well. Semi-10, so our smallest muscle, so lowest force output, long fascicles, so works really efficiently over a greater range of motion. Small tendon to fascicle length ratio, which makes it better for speed work, and a high stretch shortening cycle. So interestingly, they found that this was the most developed in elite sprinters. So I don't know if you guys have noticed at all with your sprinters, but would be to do with how much SSC demand there is. So long head of biceps, sort of in the middle, so moderate everything. It's long head and short head are innervated differently, so we have different nerves, which is relevant. So again, complex insertions, so proximally we have the free tendon, the conjoint tendon, and again onto that sacrotuberous ligament. And then distally, it attaches to a fair bit, so fibula, LCL, tib ant fascia, ITB, popliteal tendon. And then we come to our short head, so it's more of a synergist knee stabilizer, again, innervated by the peroneal nerve, not the tibial nerve, and inserts onto that posterolateral corner and superior tib fib joint. This is a table that he used just to highlight, like in terms of muscular architecture, like what sort of role that they might have. So they'll all come together and work really efficiently as a unit, but yeah, if you want to try to train one thing, then we probably need to work within the constraints of what it does. So yeah, so hamstrings, not just knee flexion and hip extension, plays a really big role in knee stability, offloads the ACL, controls that tibia rotation, and then the pelvic stability. Quads, so VL and VM. Just quickly went through this. VM has a few insertions distally as well. And then rec fem. So rec fem, we have 3 different tendons. So we have a distal tendon onto the quad tendon, but then we also have like a direct head and an indirect head as well. So we can sort of see through here. So this is its attachment. It's hard to see, but up into the ASIS, that indirect head actually wraps around the hip joint. So it plays a really big role in hip stability. So it helps approximate everything in that capsule, helps to centralize that humeral head, and also acts as like an anterior block or a buttress to sort of stop excessive anterior translation. And again, another table just highlighting the different structures around the hip and the quads and sort of what their role is. Have a look. Have a look. Good question. I'm not sure actually, you didn't highlight that. Yeah, or maybe the things that make the qualities that are most relevant to what they do. Cool, so just fibre types. So mixture of T2, T1 fibres. So your T1 fibres are more fatigue resistant, so able to withstand high volumes of work aerobically. And then your T2s, so your high RFDs, work anaerobically. So most are T2. Semi-MEM is, again, a large force-producing fatigue-resistant muscle. So T-junctions, we have 2 types. We have a deep and superficial. So we look at this through an MRI. So our superficials is going to be, so that's your T-junction injury. Along this outer board is going to be your superficials, and as it cuts into the muscle, that's going to be your deep injury. So your superficials are more common, usually associated with more pain, bleeding, and a longer return to play. Your deeper ones, not so painful and typically have a high rate of re-injury. Most likely because pain's more of a limiting factor with the superficials, so we can probably pace that rehab a bit more. With our not so painful ones, might be more tempted to go with a more aggressive solo rehab and try to push things along faster, and that's when they break down. Delaying running, and he recommends that with most distal hamstring injuries, just because biceps short head is the only hamstring that undergoes an eccentric contraction during stance phase. And then surgical indications, distal detachment, and then just multiple recurrences. Cool. The other thing there as well is that with the hematoma, that can sometimes create a gapping in the muscle when that resolves. So it's important to identify that, and that's identified really well with like a dynamic ultrasound. If we see the contraction, we can see there's a dysfunction in the way that the fibres move. If that's the case, like we need to wait for that to heal. Like that needs to basically refill before any high-speed stuff. So MRI risk factors. This is more generally speaking, not just T-junction. So this study, they looked at 5 key radiological findings. So all of them there, if they have 2 or more of them, then they're going to be at high risk for recurrence. If they have, sorry, there should be a star there, but the ones that are asterisks, just one of those places them at a really high risk for recurrence. Cool. Any questions around this one? No. Cool. And radiological healing does not equal low injury risk.
Actually, one question.
Yep.
Now, taking all this into consideration, obviously, it's a lot of the people that present on this are in professional sports. Your understanding of this now, would you change your practice with most hamstring injuries and actually MRI at a community-based level?
I tend to either way. Like a lot of at Coburg, I'm going to MRI every hamstring that comes through. But even
lower level than that.
I reckon I'm still MRIing the guys that come through privately. Especially if they're recurrent. Just because you don't know what structures are involved. You don't know. It's impossible to predict what grade they have, what structures involved. People have such different pain thresholds. Like we had 2 guys last year, grade 1 biceps fem, just like myofascial almost. Thought it was a rupture, he was carrying on that much and was really slow to progress. Versus someone else who, tested really well straight away, progressed really quickly, and that was probably a more grade 2B. He talks as well about a risk factor or something to be cautious of is the really rapidly improving hamstring. And I reckon that's probably just to do with respecting the biological healing timeframes of things. So yeah, healing timeframes. This is more just general, but maybe it gives us an idea as to by 4 weeks, we hope to restore a lot of our tensile qualities. Aponeurosis takes longer to heal, and that's probably why those sorts of injuries are the ones that tend to recur and be really persistent in 2 steps forward, 1 step back. But yeah, even with a free tendon repair by 4 weeks, that tensile quality was really good. Change in theme. So joint angle requirements, this is what, he put this down as these are the joint requirements that he looks for, the criteria he looks for before returning someone to run. So propulsion is your concentric output, your landing is going to be your decentric. It's decentric, eccentric. So just at the different joints, what's actually required to do things well without compensating. I reckon it'd be more like a biomechanics, the markers, whatever. All of his work is through Man City, so they'd have good stuff, yeah. Right, sprinting demands. So calf and quad established to be really important when it comes to running. If he says that no matter what injury it is, if you have a strong calf and a strong quads, then chances are you'll be fine to run. So I think the soleus is pretty established in terms of how important that is when returning to run. The quad stuff's interesting because the rest of your quads, your knee extensors, they stay pretty stable as we increase our speed. But if you look at the rec fem, that increases pretty exponentially as we double our speed. So just sort of highlights the amount of demand that gets placed intramuscularly as we ramp up speeds. Right, so then profiling. This is what he aims for. So in order to achieve adequate vertical ground reaction forces, so the amount of force into the grounds without needing to again compensate through other structures, looks at these relative for ankle and knee iso push, and then your isokinetic dyno. A balanced hip profile. So this is all in relation to hip extension. So just sort of highlights what percentage of hip extension should everything else be to be pretty well rounded. So, and that's tested in our strongest positions, which he shows here. So hip extension, he gets them in about, what's that, 30, 45 degrees of hip flexion, and just sort of pushing out. And then hip flexion, slight knee bends, slight hip flexion already. And this is around just at what range are they going to output the most force, irrespective of what muscle we're using. So it's more just a joint output.
So he does supine and not seated? Or does he do seated as well, knee extension?
So that's something that we'll look at your rec fem pretty closely. So like an active knee flexion into active knee extension. That yields, does it show in the next slide? No, there's a slide that sort of shows the EMG graph at different angles of knee flexion and hip flexion. But obviously at that angle, like your other hip flexors are working pretty hard, your quads are working pretty hard as well, so we can't, and we'll come to that with like some exercise selection stuff. Like although that's the best way to recruit force through that muscle, it might not be the best way to like isolate or like rehab that.
You reckon it's the best way to produce force through that?
Yep.
So shortened proximally and lengthened distally.
Yeah. So it's all with these biarticulate muscles, like your biceps fem as well, that optimum force tension relationship or force length relationship is going to change. So like I'm sure you could find something similar if we potentially had less hip flexion, more knee extension, but it's just like like if you move one end, you've got to move the other end. We also want that same tissue length.
And sorry, why knees straight and not bent for hip abduction?
I reckon that's to get a true abduction, as opposed to a little bit of external rotation, internal rotation. Because with a 45, you're still going to get a little bit of rotation. Cool. So back to the balanced hip profile. Do we all chase like 1-to-1 ratios? Hip flexion, hip extension, hip abduction, hip adduction? Yeah. He says it's very hard to achieve. So recommends to couple your extension and abduction together, whatever that sum is, and then compare that with the sum of flexion and adduction. And that'll be because in our functional movements, when we flex our hip, we're going to get some degree of adduction. And when we extend or push through the ground, we're going to get a degree of both as well. So together, we want them to be equal. So that should be intramuscular. Intramuscular forces going through the muscle. So this is torque. This isn't force output. So as our speed increases, again, we know that a hamstring load increases as well. So these are some markers that he looks at each sort of speed marker, what they should be outputting objectively. So the 3.4 at, 11 or 12 meters per second, we need to account like the lever arm or the moment arm. So if they're looking at hamstrings, we're measuring from the knee joint. We'd measure like, all right, what's the distance between knee and wherever we're putting that pad or the dyno. And that's how we can sort of calculate our torque. So this is based off like a 70 kilo athlete. So in order to achieve this 3.4, they should be outputting on our force frame or valve staff 55 through like a knee flexion. So what, 550 newtons roughly. It's similar to rep fem, so yeah, just what we expect at different speeds. Cool. All right, so then we come to like sort of joint angles and biasing muscles. So it gets a little bit confusing. So rec fem, again, we can see that hip at 90 and knee at 90, we have the highest amount of torque and EMG activity through there, and it drops off as we extend our knee more. So the hip stays at 90, and alternatively, if the hip angle is the variable and the knee is a constant at 90 degrees, it's still going to be around that 90. But again, you probably can't account for everything else that's assisting. So we can look at hip flexors here as well. In that pretty much anything past, what's that, like 60 degrees, psoas, iliopsoas comes on pretty heavily. So again, it just comes down to considering your biarticulate joints and trying to find like that optimum range. This other study which I found just sort of says like 0 to 40 degrees of hip flexion is also a really good way to sort of isolate or try to take out everything else. Cool. All right, so then hamstrings. So we're looking at hip flexion / knee flexion. So EMG activity at 45 degrees of hip flexion. That first like 10 to 20 degrees of that motion is going to work more that biceps long head. Anything higher, we can see that once we get to like 60 or 70 degrees, that semi-T comes on. And then again, similarly, we can achieve the same thing with biceps long head in a 90-degree position, but then we change what's happening at the knee. So if you change what's at the hip, you got to change what's at the knee in order to bias one muscle in particular. Semi-T and semi-MAM, your medial hamstrings, they're going to be more at hip 0, which sort of reflects that Nordic position. Cool. So then something else that was really good is that I don't know where he got them from, but he has a lot of like exercise or like other metrics that aren't just iso contractions. So like, what do we expect them to be able to achieve for a 45-degree hyperextension? So this is I'm pretty sure this is just an eccentric. I'm almost certain this isn't a concentric. So we can see that like what we're aiming for males and females, and then we want really good quality 4x4 doing that. Hamstrings, so Nord boards. There's a few studies that sort of highlight that like 350 to 400 newtons as that like metric or that marker for injury prevention, but this is our relative goal, so 5 times. So again, for like your 70 kilo athlete, 350 roughly. Bosch holds on the GHD, 6-second holds, aiming to load up with that amount. More endurance goals, I think we're pretty across this, just like hamstring bridges, 30 plus for elite, 25 for general pop. That's what we'll aim for. And yeah, quad, so this is going to be more rec fem. It's more rec fem if the cuff's more distal. I think he was saying it's more psoas if it's attached up past the knee joint. So this is what we aim for from an endurance point of view.
What is she doing there?
Hey?
What is she doing there?
It's a cable machine.
Yeah.
Yeah.
Would it bias rec fem or psoas more based on the line of pull though, and where the cuff is? Like if she's just bringing knee to head,
Yeah.
and the line of pull's kind of with the superficial aspect of the knee, like you could think more psoas, but if she was trying
Yeah.
to extend the tibia as well, the knee, would that change?
I think so. I think the general trend is that because we're cuffed at the ankle and the knee joint's involved, and there still needs to be some like control and stability of that, we're going to be working like that proximal rec fem, probably not doing much distally, and we won't be able to stop like your other more dominant hip flexors from coming on and getting past that 60-degree mark. But yeah, it's still gonna work it, I suppose. Yeah, okay. I actually know what the difference is. Or maybe that's more extension in supine, because that's the same thing, just that hip flexion around the ankle. Again, I don't know where he gets the loads from, but it's just what he aims for.
It's probably just done it from his experience.
Just anecdotal, yeah. Step ups, so we have a relative goal, 1.8 times body weight, 1.2.
It's the size of the step to be able to do 1.8 times your body weight, the height of the step.
Just a small, moderate height. So I'd imagine like our 30 centimetre boxes are pretty good for that.
30 centimetre.
Smaller,
Yeah, 30.
like a double plate type thing.
Plate, yeah.
Mm. Split squats.
Could you potentially table these up?
Yep.
For for an accessible PDF for everyone?
Just all these things.
Yeah.
Yeah.
I think that'd be good.
All right, and then I learned about this. Does anyone use this? It's fucking hard. Everyone's gonna do it. So let's go through maybe just a couple of exercises that he likes to do. Let's start with the rec fem stuff. So we'll start with these. Essentially, it's just like a motor control endurance sort of test. So interestingly, like we have a new player this season who's done like 6 rec fem tears in the past couple of years, done 3 last year. Like really strong globally, but the moment we try to challenge things in like a lengthened position or other things, he just breaks down. He can't even get 6 reps. So that's something that we're focusing pretty heavily on. All right, so everyone finds a bench / box. We'll see what we get to. No, use up. One leg. So get into like a decline plank. Yeah, so you want to keep the knee straight. Yep. So we're aiming to keep like hip still. So you're aiming to keep like all of this really, really strong. Let's take off one leg, I don't mind which one. Yep, and you're just gonna let that knee lower to the grounds. All the way. Yep, and then push up. Good. Just gonna wrap that out.
And it's like, what if you see, like for example, my hip drop? When do you say?
Yeah, I think I've been tending to cut it off the moment we see like a technique breakdown. Just after sort of hearing and reading about like how much the joint angles matter. Again, with our biarticulate joints, like a slight forward lean or a slight hip flexion is going to change things. So we want things to be really, really strict there.
So comparing the images, so like his weight on hip flex and some small plank.
Yeah, would more hip flexion be more rec fem than like large?
Do it again. Do you want to do it off the bench?
Yeah, because what just happened?
Did you feel it in your quad or in your core?
Yeah, I felt it a little bit in my quad.
You can probably play around and just sort of, because again, that like 0 to 40 degrees of hip flexion was like that sweet spot for output. So you can probably just play around and sort of see. It's important like where they feel it as well. That's a big part of it. So start from that top position.
Sorry, would you change it based on like sport? And so say if it's an endurance athlete, they don't want hip flexion, but for a footy player, they're getting into so much more hip flexion. Would you then change the test based on that?
As in like the joint angles.
Yeah, like so endurance run, like probably like what was doing the lower boxes was alright.
Yeah, yeah.
Versus like footy player, they're getting into full.
Oh, so it's probably easier.
Yeah. You could, but I think this is purely like a tissue strain test. Like, how can we place the rec fem in like a really lengthened position and load it there? So just like come forwards. So wait, so get into that plank again. All the way, like knee straight.
Oh,
Yep. There we go. And then take one leg out, and then drop. Yeah. Yep.
How many reps are you chasing?
30.
What tempo?
Just like a 1 second.
1 second.
Yeah, just controlled.
so kind of my foot. Oh, it does. You feel it, like.
Yeah.
You definitely feel it.
All those push-up stubs.
Too much bench, not enough rep.
It's just an option because I feel like we don't, like we use like the single leg hamstring bridge so much as like a early mid-stage metric. Like I've never even considered doing something similar for quads or rec fems. So it's just another tool. It's not like necessarily something that you can sort of hang your hat on and be like, all right, cool, they're going to be good to go. Because like, I guess it just comes down to like your assessment as well. Like where are they weak throughout that range of motion? Like you might, like for hamstrings, they might be really strong at 90 degrees. If you push them into 5 degrees more flexion and test that again, you could be way weaker, right? So just making sure that we assess things at pretty much all joint angles to highlight where are they weak, where are they strong, and also sort of comes down to like surface anatomy as well. So like when we look at athletes or people, like what's their bulk like? Like are they, like do they have really overdeveloped medial hamstrings versus lateral hamstrings? Are they more proximally, are they like bigger proximally? Do they fall off somewhere? It just sort of gives you an idea as to, again, probably like what their loading's been like and what we might need to work on to build a more well-rounded hamstring. All right, someone else?
Everyone do a try. Everyone got their best.
Do what's comfortable. I found flat foot uncomfortable, but I'd probably go add a bit more.
Yeah.
Yep, and go. Where do you feel it?
My core.
Your core? Yeah, so really, really try to lock at the knee. And think about as well, maybe even like as you're dipping, like rocking back a little bit. So trying to bring the knee in towards bench. Slightly. Yep. So as you come down, yeah, you're going to come back a little bit. Does that change things? Just cool, yeah. There'll be another one that we go through that.
Can you watch me do it? Because it didn't feel too. No, I don't train my rec fem.
Drinking you 30.
I don't know.
Yeah, looks pretty good.
I actually reckon I'm close.
Yeah.
Probably not 30.
Yeah. Three sets of 30.
Oh, here we go. it. I'm just saying you're the one that's watching the film. Yes.
That's where you're missing it. I think you're probably still missing the straight of the knee. You're more focused about the displacement of your hip. Bend the knee, come up and straight.
Just feels like a TK.
Pretty much, yeah. It's like a bodyweight TKE.
I was really good at it.
Good. Quad work.
Smash it. Yeah, it just feels like an
Yeah.
Yeah, I get that.
I guess it's just like a box to tick.
Why don't you fucking hit 30 there?
All right. Okay. All right. Can I get someone else for this next one? George? Another exercise. So we're going to go a front foot elevated split squat.
Yep.
So, but all your weight's going to be on that back leg. Okay? Yep, so you want to be as upright as possible. So all your weight's on that, you're going to drop that knee down to the ground. And then back up, pushing through that back leg. Yeah. So, again, the guy at footy could do 4 reps, I think. And then we can see that he starts to even like shift his weight forwards a little bit. So what we want to try to encourage is that like you're sitting back into that. So as you're coming down,
What angle should my front shin be at?
whatever's comfortable.
Negative?
Yeah. Because I guess all we're focusing on is just all that tensile strain through there.
I feel it more on my, like probably distal quad, like the tendon.
There wasn't. No. But I'd probably just go try to aim for 20. I don't know, just a random number, and then we can load it.
A what? That probably feels more
Yeah.
quad. And if I dump, I kind of get more my PFJ.
So yeah, so you can look for like subtleties as like how do they shift their weight forwards and backwards, what happens there, because that will change pretty heavily
Yeah.
how it is. Cool, what time is it? Anyone want to try? No? No, I'm going well, got 15 minutes left, plenty. All right. Give it a go, and then we'll go hamstrings. And then we'll do hamstring stuff. So all your weight's in the back leg. Yep. And you're just going to drop things straight down. Okay, cool. Probably don't want to lean back so much. Have that whole foot on the plate. Yep. Yeah, cool. How's that feel?
That's fine.
What do you feel it?
Yeah, quad-ish.
Yeah, cool. So just make sure that we don't travel, like we don't bring this forwards as well. Right, so like if there's a block, we're blocking here, so like keep this angle 90 degrees, so keep both knees 90 degrees. Just drop. So like I don't care what happens here, like we can flex here, come down. But yeah, we just don't want to,
Can't balance.
yeah, that's the hard part.
I feel like heaps in my lateral hip, but I've also got a shit lateral hip.
Yep, nice.
Yeah.
Cool. All right, so one thing that he always defaults to as well for hamstrings is like a B stance RDL with like kettlebells or a trap bar or something similar. So I want to grab a pair of dumbbells. Someone? I don't care how heavy it is. All right, not easy. Take your shoes off.
Take my shirt off.
All right, cool. All right, so go into your B stance RDL. Yep, and just go some reps. Cool. So with sort of what we know about like how the tibia rotation influences like what muscle we use or how things go, we can shift things, so we can shift our weight to the outside of our foot. So like we're not necessarily, so we're just trying to push through there. So we get a little bit of like tibial external rotation happening. And then alternatively, we can roll foot all the way inwards. And that tibia internal rotates.
Yeah, it feels a lot different.
Yeah. Where do you feel this one?
Feels more like inside.
Yeah, more inside. And if you shift outwards,
Yeah. Definitely more
a
like.
bit more outside.
Yeah, outside.
Yeah, cool. So it helps that he feels it. Some people won't.
Like yeah.
Yeah.
You feel like more the hamstring's working when you go roll outside.
Yep.
You go inside. It's very different.
So for someone, let's say, who has, I don't know, like no proximal biceps fem, this could be a good option to try to hypertrophy that or try to work that more. Like have the front foot up on a wedge. Oh. You could, I suppose. I don't know.
Some days you're obviously going to want to just collapse it because you can't maintain it.
You could do something like that. Yeah. Cool. All right, you can put those in. That's fine. And then the hamstring curl. Do you have a yoga block? No. Yep. But standing. I'm going standing. Yep. All right. Liv. You're up. All right, so is there anything that you can stand on? Not really. That's fine, doesn't matter. So we're going to go like hip at 45 degrees. And then again, we know that at 45 degrees, that like 10 to 20 degrees is going to be where that biceps long head's going to work the most. So literally, like we can load up as much as we like within what this range can tolerate and just go from there. Okay? And then we can obviously rotate the tibia as well to if the athlete needs to feel it more. So, hey? Yeah. So it's still like controlled, but just within that, because that's really easy.
Do you still want to go as heavy as tolerated?
Yeah. Because if we're trying to chase like hypertrophy, because that's probably what we'd use this for, then it needs the intensity, all your other principles need to stay the same. Good. Come down all the way. Is that all the way? Yeah, just there. Come all the way back down to 0. Yep, and then go again. Good. Where do you feel that? Is it too light? Okay. Now if you straighten up, so keep the leg where it is, but just go 0 degrees hip flexion. Does anything change? Yeah, cool. So it's probably like your more semi-mem. Yeah.
Do you ever change plantar flexion and dorsiflexion to influence like hamstring recruitment as well, like when they do Nordics or something?
Yeah.
Like this?
I think you'd want to take out your calves if you're doing this.
Yeah.
So we're just trying to isolate specific tissue. Cool, but yeah, we can play around with that. You could, if you want to work like medial, you could just go like a normal prone hamstring and just work within that, like what, 60 to 70 degrees, like it said, whatever it said. But yeah, and just play around with like angles, and probably really important to sort of get feedback from the athlete about where they feel it, because we can't just assume that it's doing what it's doing.
I think it's even more important with the ACL than with that flexibility as well, because
Yeah.
they're just so prone to compensate.
Yeah.
And like even one thing,
It doesn't really change. I don't feel any difference. No, I was doing it the other day and I didn't feel it at all. Internal, external. So just here.
The internal, external.
Broken.
Cool. So yeah, so they're just some things to play around with. Lie on your tummy for a second. So just circling back to like assessment findings, if you want to try to like search for that over-compliant tendon, we can get them doing like an inner range hamstring curl, where if you keep that really close to you, I'm going to pull you out. Good. Do you feel like you're going to cramp? No. So if they feel like they're going to cramp, or there's like a really significant weakness on one side, then the way that we try, to like stabilize that is that we find that conjoint tendon. So go. So probably there. So we add like some external support to that. We compress that and then pull in. And that'll get rid of their cramping. So like if that's the case, then we can assume that, all right, maybe there's a bit of overcompliance and maybe that correlates with more range through that side as well. So like if you ever do like a straight leg raise or a hamstring length assessment and the injured side has more range than the normal side, then I used to think that that's whatever. It's not really a finding, but it probably is. It's probably something where that's outside of their normal. And then cluster things together.
No, would the injured side not normally be much stiffer?
Okay.
Would that be common? Not like, is it not normally that the injured side is much stiffer if you were to do like a straight leg raise or a hip flexion knee?
The injured side would be stiffer. But I'm saying that if the injured side has more range than your normal side, then there might be something there as well. And then flip onto your back. So similarly for like rec fem, straighten your knee. So tense your quads, this one. Cool. So we just sort of find where that muscle bulk drops off, about there, and just sort of find that. We come into that like 90-90 position, and then kick up. Great. And then what we should go harder. And what we should see is like a bit of a gap, right? So like as we shorten that muscle, then like it should change like where that drop off sits. If there's no change there, then that's a sign that there might be some overcompliance. So like he saw that a lot in like rec fem ruptures and those sorts of things, where there was no slack in that tendon to sort of pull things back. But yeah, they're just little like assessment things that you can just sort of look at. I've done the hamstring one a couple of times and it's worked for some people, but I don't know how much it's like it gives you an idea, but I don't know how much it actually tells you, I guess.
So sorry, when you do the prone inner range test,
Yep.
what are you testing?
Like fascicle lengths to some degree as well.
Yeah.
It's like if they're struggling to work in a really shortened position, because all the overlapping of like muscle fibers and all that sort of thing, cross bridges, then yeah. So essentially it's like,
so
if the tendon is overcompliant, then the whole muscle tendon unit to the fibers as well are going to have to work a lot harder to perform the same amount of work, which is why we might get cramping.
And which tendons are you looking at for that one? It's like all of them for the hamstrings?
It's just the conjoint tendon, so just where it originates onto that pubic rami.
And then obviously weakness as well in that range.
Yeah, so you can assess the weakness, like it could just be weak. But then if you apply the external pressure, if there's a significant strength increase, then you're taking away some of that demand for stability as well. All right. Cool. All right, I can send through, the rest is just like the framework that he goes through. So just like a 7-stage thing that you can use for everything. And that's an example of how we might structure like a hamstring rehab so we skip stages 1 and 2, which is just your acute management. And like some examples of loading and what we're focusing on. And then similar things for rec fem as well, like what are we aiming for, at what stage. So starting to sort of think about like exit criteria for each phase and what they need to tick off. And yeah, this is again what we're hopefully looking to achieve for each quality. So this is probably more like at the very, very end what we want to see across the board, as well as like for each demand. And same thing for rec fem as well. But I'll put that in the PowerPoint to look properly. Good timing. 30 seconds left. The T-junction one?
Because you just talked a lot about thick tendons, strong tendons, or iron tendons.
Yep.
It shows it really nicely there. If you zoom in. Like you can actually see the tendons on the scans really well. So that looks like a pretty thin tendon. That's looking thicker. That's looking thicker again. Like what's going to be the strongest tendon of the lot? It's the most dense, least water in it. So if you're seeing really thick tendons through the MC junction or anywhere else, you can assume they're probably really tendon dominant athlete. You just want to change the prescription around and not give them heaps of pliers because they're already going to be fine for pliers. You're probably going to push it too far. So then you can't have to just program and do more in the muscular sense. So that's just an easy one. Once you see lots of scans, you end up picking up that pattern. I think it's been nice little bit of a good picture.